Hello, welcome to the Pelvic Health Education session. The aims of attending today's sessions are understanding the pelvic floor, learning about its anatomy and function, what is incontinence and what causes it, what is prolapse and what causes it, teach you the correct pelvic floor exercises, how the bladder works and bowel health advice, how can physiotherapy help, lifestyle advice, so things you can try straight away after today's session. This picture shows a side-on view of the pelvis. In the picture you can see the three pelvic organs. So just to orientate you, if you look at the left hand side you can see the stomach, then if you go down you can see the leg, to the right the buttock going into the spine. So the bladder sits at the front of the pelvis. The womb that sits directly behind the bladder, and the bowel that sits at the back of the pelvis. Underneath the pelvic organs, you can see the pelvic floor muscle. The pelvic floor muscle originates from the pubic bone and inserts into the coccyx. If you imagine this picture as a 3D structure, the pelvic organs sit on top of the pelvic floor muscle. This is why the pelvic floor muscle has such an important role in the function of your pelvic organs. Pelvic floor function. What does our pelvic floor help us with? It keeps us continent of urine and feces. It gives us stability to the spine and pelvis. It supports the abdominal and pelvic content. It's an important role in sexual function, and it has a protective reflex. Our body has lots of reflex mechanisms, a common one being our eyes and blinking. An example of this is when something like confetti is thrown towards us. We would blink to protect our eyes. This happens so fast we don't even think about it. Our pelvic floor has one of its own, so when we do something like coughing or sneezing, it will gently contract to support our pelvic content and keep us continent. Types of incontinence. Urge incontinence, which is abbreviated as UUI, is when you feel the need to pass urine and you can't hold on. Stress incontinence, which is abbreviated as SUI, means you leak urine when doing a certain activity like coughing, sneezing, jumping or running. Stool or fecal incontinence, which means poo, is when you can't control your bowels. Wind or flatal incontinence is when you can't control passing wind. Other symptoms that may affect your bladder or your bowel are urgency in isolation, which means there's no incontinence, frequency, so passing urine or feces more than normal, and nocturia, which means peeing during the night. True nocturia is when your bladder wakes you, not that you are awake wanting to wee. What is urinary incontinence? Urinary incontinence is any unintentional loss or leakage of urine. Incontinence is largely preventable and treatable, and certainly not an inevitable consequence of aging. So this does not mean because you are getting older, it's normal to leak from your bladder. How common is it? Approximately 5 million people in the UK are affected by incontinence, and 23 to 46% of women in the UK are incontinent. And of those, 50% are moderately or greatly bothered by the symptoms. 20% are unwilling to go places where they're unsure if there are toilets. Some of you may feel that you could map the toilets in your local area. 31% said they dress differently. 23% said it affected their sex life. 23% said it reduced their activity levels. And 25% reports a feeling of frustration and or embarrassment. Here are some common coping strategies for managing bladder and bowel symptoms, but are all myths, so let's go through them. You can catch germs through sitting on a public toilet seat. This is very unlikely. You should always try to sit down and relax when on the toilet. Hovering over the toilet can cause an increased contraction to your pelvic floor muscle, which reduces the efficiency of emptying your bladder and your bowel. It's good to stop my urine flow to test my muscles. We do not recommend this. This is not a good way to do your pelvic floor muscle exercises. This can also cause water infections. It's normal to leak a little when you cough. As I said previously, it's not normal to leak. I drink less if I'm going out, so I wee less, or I'm less likely to have accidents. This is not an effective way to manage your bladder incontinence because it actually reduces the volume of what your bladder can hold. If you do this repeatedly, you end up visiting to the toilet more often. Straining after a wee ensures I fully empty my bladder. We do not recommend straining to empty your bladder or bowel, as this puts more stress on your pelvic floor muscle. You should open your bowels once a day, only if this is normal for you. Normal can be within the range of once a day to 3 times a day to 3 times a week. Food goes straight through me. Certain foods for certain people can stimulate the bowel movement, and this is normal. However, it is very unlikely that when you eat something, you will pass it straight away. It's likely to be yesterday's food. What is a prolapse? Prolapse can occur when there is a weakness in the supporting structures, allowing the pelvic organs to descend and ultimately fall through an anatomical defect. Prolapse literally means a fall or a slip out of place. How common is prolapse? 80% of women have vaginal wall laxity. For example, childbirth is one of the most common reasons, and this laxity may not cause you any symptoms, therefore it's nothing to worry about. But by following the advice in this presentation, it may help. 40% of women over 40 years of age have prolapse, 50% of women over the age of 50 have prolapse, and 60% of women over the age of 60 have prolapse. The incidence peaks at roughly 65 plus years. This is because by this age you've had your children, you will be postmenopausal, and during the menopause a hormone called estrogen greatly reduces. This hormone helps with the health of the vaginal tissues, and naturally the older we get, muscle fibres thinning, so your pelvic floor muscle is no different. 2% of women without children develop prolapse, and this is usually a uterine or a womb prolapse. And many women do not require surgery to improve their symptoms. These women will improve with physio and management strategies. Symptoms of a prolapse: dragging feeling, feeling of something between the legs or a fullness within the vagina, backache, abdominal discomfort, altered continence to the bladder and bowel, difficulty emptying your bowels, and intercourse can be difficult or embarrassing. You may have one or several of these symptoms. This slide is showing you the different types of prolapse. Top left is a picture of your normal anatomy. So similar to the first picture we saw, on the left hand side you can see that the bladder is labelled. Coming down from the bladder is something called the urethra, and that's the tube that we wee out of. Behind the urethra you can see that the vagina is labelled with 2 lines facing upwards. These are your vaginal walls. If we move over to the right hand side, and you can see a bladder prolapse or a cystocele, you can see that the vaginal wall at the front is lax or prolapsed. This is an anterior vaginal wall prolapse. The urine is still contained within the bladder. However, when the bladder fills, it will fill to the bottom part of the bladder and fill up. You will empty everything above the urethra. Everything below the urethra will stay there, and this is something called incomplete emptying. Something to help this is something called the double void or a double wee. And how to do this is when you sit in the toilet, use gentle pressure on your bladder. So use 2 hands, just at the lower part of your tummy, gently press, lean forward, lean back, and then empty your bladder. If this doesn't help, do it in standing, do a bit of a wiggle, and then sit back down. Bottom left is a posterior vaginal wall prolapse, or a back passage prolapse, or a rectocele. And this essentially is the same as the bladder prolapse, however it's affecting the rectum. Again, you can have incomplete emptying of your bowels, and something that can help this is splinting. You can splint the perineum or the vaginal wall. To splint the perineum, you can gently push up between your vagina and your back passage to help pass the stool. If that doesn't help, you can use a finger or a thumb vaginally and push back to help empty your bowels. Moving on to the next picture, which is bottom right, this is a womb or a uterine prolapse, and this is when the womb descends down into the vagina, drawing the front and back wall of the vagina, which can have an effect on the bladder or the bowel, or both. The next slide shows grading of prolapses. We grade prolapse from 1 to 4, 1 being mild, 4 being severe. The first picture shows again that normal anatomy. The next one will show gentle laxity. You can see a slight descent, which is normal laxity after having childbirth. The next would be a grade 1, then a grade 2, then a grade 3, then a grade 4. There are different stages in our lives and factors that can contribute to causing incontinence or prolapse. The first being genetic. You can have a family link, so your mum, sister or grandmother may have suffered with these symptoms. Or hormones. And during a woman's life, hormones change with time of the month, pregnancy, postnatal and menopause. We can't change genetics or hormone, but later on in the presentation we can help you manage them. We then move on to life stages: pregnancy, labour, menopause and ageing. Again, later on in this presentation we can help you manage them. Changeable factors. So these are the factors that we want to focus on because these are the ones that we can change to help improve your symptoms. Later in the presentation, we will go through each of these individually to help you manage and give you some advice. How to perform a pelvic floor muscle contraction. Before you start, find a comfortable position and relax. Make sure you keep a normal breathing pattern throughout. To begin, tighten it around your back passage as if you're trying to stop yourself from breaking wind. Then tighten the front as if you stop yourself from passing urine. You should feel a squeeze and lift in your pelvis. You want to aim for an up and forward direction. You may feel your abdomen tighten just above your pubic bone, and this is normal. Am I doing them correctly? Research shows that up to 50% of us do them incorrectly. When doing a pelvic floor muscle contraction, try and avoid breathing in or holding your breath, pulling in your tummy muscles, squeezing your legs together or clenching your buttocks, or bearing down, so the feeling when you open your bowels. There are 2 types of exercises you can do for your pelvic floor muscle. The first being a slow squeeze. So this is a gentle, gradual contraction of your pelvic floor where you want to hold it. The aim is 10 seconds, 10 times. However, if you haven't done your pelvic floors recently or never done them, it's unlikely that you're going to be able to reach that 10 seconds 10 times. So what we would recommend is drop it right down to between 3 to 5 seconds and slowly build up. The second is fast squeezes. So this is a maximum contraction of your pelvic floor. So it's exactly the same technique, but you contract it on and you release straight away. So it's like on and off of a switch. You want to aim again for 10 of these. However, you may not be able to reach 10, so again, drop it right down to between 3 or 5 and gradually build up. You also want to try and do something called the knack. This is a gentle contraction of your pelvic floor muscle when coughing, sneezing, laughing or lifting something, or when your symptoms are worsened by inactivity. How to progress your exercises. So the easiest position to start is in lying, then try sitting, then build up to standing, and then with activity or exercise. Practice makes perfect. This process can take time and commitment, so don't worry if it doesn't happen overnight. Can I check my pelvic floor contraction myself? Yes, you can. On the left-hand side, you can see someone using a mirror. When you contract your pelvic floor looking into a mirror, you should see that pelvic floor drawn away from the mirror. When it relaxes, it releases towards. You can also do a self-assessment. So make yourself comfortable, prop yourself up with a pillow and bend your knees. You can use a thumb or a finger, insert that vaginally, and when you tighten your pelvic floor, you should feel it tightening around the finger, and when you release, you can feel that pressure reducing. How to stick at your exercises. So you can use an app called the Squeezy app, and this sends you reminders 3 times a day, as that is what we recommend that you do. You can do them at set times or tie them into your routine. So an easy one is breakfast, lunch or evening meal. You can also use post-it notes or reminders around the house or the workplace to help you remember. Weak muscles take an average to 10 to 12 weeks to strengthen. This slide goes through normal bladder function. So a full bladder can hold up to 500 mils. So this is a small bottle of water, and this is the amount that you tend to pass first thing in the morning. Your first desire to want to go to the toilet is approximately 200 millilitres. Visits to the toilet, what we class as normal, is 4 to 6 times a day, and overnight is once a night. Your daily fluid needs is 3 pints or 2 litres. On the right hand side of the screen, there's a picture of our bladder. Surrounding the bladder is a muscle which is called the detrusor muscle. Underneath the urethra is our pelvic floor muscle, and these muscles help control our continence. This is a fluid chart or a bladder diary. You may have seen one of these before or been given one by another healthcare profession. If you haven't, you can download one from our physiotherapy website. It has all the instructions of how to fill it in on the back of the sheet. It is important that you complete one of these prior to an appointment, as it can tell us as physiotherapists a lot about your drinking and bladder habits and your bladder function. So if you look at the fluid chart, you can see there's columns of fluid in, drink type, leakage, urgency, and fluid out. So if you were going to fill it in, so we'll start with first thing in the morning. So say you get up at 7 o'clock in the morning. Generally, you want to go to the toilet. So you'd go to the toilet, and what we need you to do is wee into a jug so you can measure your output. You would then put that in the fluid out column. You then need to measure the urgency of that visit to the toilet. 0 being not urgent at all, 3 being urgent. If you leaked at all, you can put wet, damp or soaked in that leakage column. If after the toilet you then have a drink, you need to put the drink type in that column and how much, so the fluid in, so you can measure how much you've drunk in. Bladder retraining. The aim is to go to the toilet when you are in control, not when you're in a desperate rush. Avoid just in case wheeze, and this does rely on a strong pelvic floor. So this is why doing your pelvic floor daily is important. If you feel that you go back and forth to the toilet, to try and help reduce this, we frequently teach bladder retraining. Here are some delay techniques. Squeeze your pelvic floor, go up and down onto your tiptoes, rub the back of your thighs, distract yourself. So go and do something that'll take your mind completely off wanting to go for a wee, or sit on a hard surface. On the left hand side of the screen, you can see the urge curve. This starts when your bladder is empty, and this increases when your bladder fills. It will then peak, and you will go to the toilet and the urge will subside. During bladder retraining, what we want to try and aim to do is go to the toilet just after the peak. By doing this, you are in control of your bladder. These factors are all things that we can influence and change. We as physiotherapists can give you advice to try and help with your symptoms, but ultimately the changes need to be made by you. Are you constipated? On the right hand side of your screen, you can see the Bristol Stool Form Scale. Type 1 and 2 are generally poo you pass if constipated. Type 3 and 4 is more sausage-like, and this is what we want to aim for. If you are constipated, these are 3 tips that you can try. The first one is drinking plenty of water. The second is eating regular meals. And the third is doing regular activity or exercise. Are your bowels involved? A lot of women suffer with constipation, and something that can help is adopting this position on the toilet. Use a small stool or something similar to put your feet on. Lean forward and place your forearms on your thighs. Breathe and relax. These are all drinks that can irritate the bladder, which can then make your urgency or incontinence worse. If you know these affect your symptoms, try and limit the intake of these particular drinks. Tea and coffee irritate the bladder due to the caffeine content. Caffeine is a known diuretic, which means this increases the amount of urine produced. It also has an excitatory effect on the muscles around the bladder and may cause it to contract more often. Low doses of caffeine can increase the strength of the bladder muscle contraction, increasing urgency and making it harder to get to the toilet in time. These are drinks that do not irritate the bladder. If you drink a lot of caffeine, try and swap these to decaf. Do this slowly and gradually. For example, if you drink 4 caffeinated drinks a day, start with 1 decaf and 3 caffeinated. Then do 2 decaf, 2 caffeinated, and so on. Obesity and the pelvic floor. A high BMI is a strong risk factor of all urinary incontinence. The higher your BMI, the more it increases your risk of incontinence. It also increases the pressure down onto the pelvic floor muscle, which can lead to an ineffective function of the muscle. Losing weight can help reduce your risk of developing incontinence and improve the effectiveness of the pelvic floor muscle. Smoking has a negative effect on the bladder and is responsible for half of the bladder cancer cases in women. Cigarette smoke is associated with overactive bladder symptoms, and smoking can affect the wall strength of the bladder. Smoking can cause chronic coughing, which can cause an increase in pressure down onto your pelvic floor muscle, again leading to ineffective function of the muscle. Here is the number for the Stop Smoking helpline. Lifestyle changes that can help are losing weight, adapt heavy lifting or anything that aggravates your symptoms, modify high impact exercise. This does not mean to stop exercise, it just means changing the way you exercise. Avoid constipation and straining on the toilet, give up smoking, address a persistent cough, and put your feet up and rest during the day. What can I expect from physiotherapy? Following this session, you will normally have a one-to-one appointment with a specialist pelvic health physiotherapist. They will carry out an individual pelvic floor assessment, which does involve an internal vaginal assessment. By doing a pelvic floor assessment, we can assess a prolapse, and it also tells us a lot about your pelvic floor muscle. We assess the strength, power, endurance, and the reactive reflex. By doing a pelvic floor assessment, we can assess a prolapse, and it also tells us a lot about your pelvic floor muscle. We assess the strength, power, endurance, and the reactive reflex. We then give you an individual pelvic floor program. If you do not wish to have an internal vaginal assessment, don't let this put you off from coming to our one-to-one assessment. We can still give you all the relevant advice to help manage your symptoms. By coming to physio, we can help you self-treat, gain confidence and control, set goals and measure your progress. What next? Think about what you can start today. We may offer you a face-to-face appointment, a telephone appointment, or a video call appointment. There's an assessment according to your specific problem. A treatment program will be agreed with you, and remember your paperwork. This being your fluid chart that you can download from our website and a list of your medication. You may bring someone with you for support. Please let us know as soon as you can if you can't make an appointment. If you have failed to attend without contacting, you will be discharged. If you are unable to attend more than 2 occasions, you will need to discuss with your physio if your care can be continued, as your rehab potential can be impacted. You can still attend your appointment when menstruating. Thank you for listening. Please visit our website for more information. And remember, make friends with your pelvic floor.